Hello. Welcome to our COVID ICU. I am Dr. Mkanana, an acting senior medical officer in the Department of Internal Medicine. I am also the head of the COVID task force for facilities at hospital level. Today, I'm going to take you on a tour of the newly repurposed COVID ICU. Where the staff will exit after their shift, and they've removed their PPE, and immediately they have access to these two bathrooms. We also have a pharmacy there where we keep our drugs ready in case the first patient walks in. Having learned from what is happening in other countries and having discussed with our epidemiologists, the projections were quite worrisome because the numbers that potentially could be experienced in Namibia were such that the existing healthcare infrastructure was not well equipped to cope. So behind the scenes, plans were made rapidly to try to have facilities that are COVID ready. You understand it is very challenging to look after COVID patients because we have to have mechanisms in place that will protect existing staff and existing patients from this special group of people. We have 17 medical officers who are right now on standby and ready to be activated should we have the first COVID patient. We also have about 5 or 6 specialists who are ready to give technical and clinical support should the need arise. We also have a dedicated team of nursing staff, at least 24 of whom are ready right now should we have a patient that needs to be activated and admitted here.
So from a nursing perspective, each department has been requested to avail some of their nurses. So we've got nurses from mental health, from theatre, maternity, oncology, the main wards, the general wards, and it's actually quite good that we have that complement so that if we do have a patient with a cardiac issue, we have a cardiac team member here that we can consult and that can help us out. If we have a pregnant mom, we do have a maternity staff member here whose speciality it is to look after pregnancies. We have someone from pediatrics. So we're looking at this from a holistic point of view.
I can confirm right now that should the first patient come, we already have the necessary drugs in store in our pharmacy right now, which will be used as necessary for a patient who's admitted here. Yes, we also have at present 4 ventilators on site, 3 of which are here, 1 of which is down at the isolation center, which are set up and ready right now to intubate and ventilate patients. No member of staff will be allowed to see a patient with COVID without proper protective personal equipment.
We know also internationally that most nurses or most healthcare workers expose themselves when they undress themselves from the PPE. So therefore practicing putting on the PPE correctly, the protective equipment correctly, and then removing it correctly so as not to contaminate ourselves is really critical. So from the beginning, we've worked on a buddy system. So all our staff have been trained according to the buddy system. And even here at this facility and at the isolation facility, we will have a buddy on the ground. So I will be outside, I will be dressing my staff, I will be reminding them of the equipment, they will call me, we will call telephonically. So I will dress them according to a checklist, and I will follow that checklist clearly, and I will have a final inspection before they come into the unit. And in the same way, coming out of the unit.
The system which we are following here to make sure that the hygiene is also maintained. First of all, when we have the admission of the patient, our staff, they need to be protected. We must make sure that they are putting on the PPE to protect themselves. After that, when this patient now they are nursing with the patients, as you see here, these equipment we are having, they are disposable. The ventilation itself, the sockets, they are disposable pipes which you use at once. You don't repeat it. That is also the system we are following. Also the suction tubing also, when we are suctioning, that machine on the other side, the suction is also disposable. We don't reuse them. So that is the system now we are following. The sterility of most of the thing is the sterility procedures. We are maintaining that everything that we are using is sterile here.
We are here at the Windhoek Central Hospital Isolation Center. So this is a facility that was specifically constructed as part of our national response to the COVID pandemic. So what you see behind me there is a 10-bed facility which can admit 10 patients who are suspected to have COVID. Just behind me, that is a donning room. So this is where the staff members will then go in to put on their protective personal equipment before they go into the patient area.
So this room is our changing room. These are the lockers for our nurses when they are going to change. So they store their belongings here after they change before they go. So this is where we are going. This is our emergency trolley with our ammo bags if we have any recess. So we use this for the isolation department. And then our fridge for medication. And then on my left, we have some our medication, fluids, and our PPEs that we are going to use for the patients.
As you can see, it is demarcated by yellow light. The red lines that you see there indicate demarcation beyond which is potentially infectious. So beyond this red line, this is the patient admission area. And we have 10 rooms in there that will admit 10 patients who have exclusive use of their rooms. Each room is an ensuite room with its own private bathroom, its own private toilet.